Hello, we're from SGDB10 and we'll present about Immune Thrombocytopenic Purpura.
My name is Vito with NIM 128. Immune thrombocytopenia or ITP is an autoimmune disease that is characterized by isolated thrombocytopenia. ITP is a relatively common disease found in humans. ITP can be found as a primary condition or secondary condition, meaning it is caused by other diseases. Most common autoimmune condition associated with ITP is antiphospholipid syndrome. Most common infection associated with ITP is hepatitis C and HIV. ITP can be found as asymptomatic in some patients, but most come to clinical practice with bleeding. Patients come to the clinic with mild or severe symptoms. Severe symptoms can also be life-threatening. Asymptomatic ITP can progressively develop to severe ITP. Raised awareness and knowledge about this disease must happen so the incidence of the relatively common disease can be decreased. With increasing incidence of infectious disease like HIV and hepatitis C, all of which can influence ITP, awareness about ITP should be increased, so the negative effect of ITP could be minimized or even zeroed out. Bleeding can result in wrong diagnosis, as there are many other diseases with bleeding. This further increases the need of knowledge about ITP to prevent wrong diagnosis from occurring in clinical practices around the world. Thank you.
My name is Krisanta Paramita Karnamaya with NIM 170. The purpose of this writing is to find the answers for such questions including first, what is immune thrombocytopenic purpura? Second, how are the epidemiology, etiology, and risk factors, pathogenesis, diagnosis, and clinical manifestations, differential diagnosis, and complications of ITP. Third, how to prevent the complications of ITP. And lastly, how are the prognosis for patients with ITP. Hence, the benefits of this writing are public can be more aware about ITP, thus may reduce the incidences and negative impacts of infection-triggered ITP. Second, medical community and also authors can further comprehend about ITP, including its epidemiology, etiology, and risk factors, etc. Third, medical community can also further understand about the treatment methods, complications, and their prevention methods, and prognosis of ITP, thus may be able to reduce the incidences of inaccurate diagnosis and treatment methods. And lastly, authors will be able to fulfill their student project assignment in the Hematologic System and Disorders and Clinical Oncology block of Faculty of Medicine, Udayana University.
Hello, my name is Madeline and my number is 093, and now I will discuss about immune thrombocytopenic purpura. This disorder is caused by an autoimmune which is characterized with accelerated destruction of platelet, and it is often occur in children and the most common cause of acquired thrombocytopenia. Based on the American Society of Hematology, ITP is an isolated thrombocytopenia where the platelet count is under 100,000 microliter. A persistent thrombocytopenia for 12 months is defined as a chronic ITP, while a thrombocytopenia that lasts than 3 months or 3 until 12 months is defined as a newly diagnosed ITP and persistent ITP. This hematologic disorder is clinically common with purpura, petechia, and mucosal bleeding.
My name is Inyuman Wigahayoga with NIM 109. I will explain about the epidemiologic study of immune thrombocytopenic purpura. The epidemiologic study report the incidence rate around children is 1.1 till 5.8 per 100,000 person, and for adult is 1.6 until 3.9 per 100,000 person. The reports tell us about that there are more incident rate in women than men, but for younger children below 5 years old and elderly above 60 years old, there are more cases in male than female.
My name is Anish Sharma with NIM last digits 251, and I'll be presenting the etiology and risk factors for ITP. So the etiology and risk factors for ITP includes environmental factors and genetic factors. For environmental factors, it includes infections such as human immunodeficiency virus, malignancy such as adenocarcinoma and lymphoma, autoimmune diseases such as rheumatoid arthritis, lupus, and antiphospholipid syndrome. And lastly, it includes drug inductions, which includes furosemide, non-steroid anti-inflammatory drugs, penicillin, quinidine, quinine, ranitidine, sulfonamides, and statins. Apart from that, genetic factors do play a role in the risk factors of ITP. Even though the genetic factors cause is still unclear, however, the body's immune system malfunctions, hence it attacks tissues and organs in the body. Apart from that, it destroys and produces fewer platelets, which leads to ITP.
Hello, my name is Putura Natalia Anggreni with student number 217. So, the pathogenesis of immune thrombocytopenia purpura is first, megakaryocyte break down into platelets. Platelets have surface proteins such as glycoprotein IbXV and glycoprotein alpha 2b beta 3. The two protein on this platelet will bind into an antibody called thrombopoietin or TPO, which comes from the spleen. So the TPO that is already bound to protein will bound into the TPO receptor on macrophage. So this TPO platelet bound will be phagocytosed by macrophage. So the the phagocytocyte platelets will be destroyed, and this is what causes ITP.
My name is Sharon Kalista, NIM 015. Now let's move on to the diagnosis of ITP. So ITP can be diagnosed first is from the patient's medical history, such as signs and symptoms of bleeding, illness or bleeding that could lower the level of platelet count, and medicines or remedies that could cause bleeding and lower of platelet count. Next is from the physical examination, which requires examination of skin and mucous membrane of the patient. So here, patient's tendency to bleed or bruise due to minimal trauma can be used as an initial suspicion of ITP. Also, there are clinical findings such as petechia, purpura, and ecchymosis occur in upper and lower extremities. Also, some diagnostic tests are most likely blood tests to check the platelet count, such as CBC, which will result in normal red and white blood cell, but with low platelet count. Blood smear, which is always done to diagnose hematologic disease, and also antiplatelet autoantibody assay that will result in a positive antiplatelet autoantibody. In addition, in some conditions, bone marrow biopsy is needed to exclude other diagnoses rather than proving ITP diagnosis.
Hello doctors and friends, my name is Giovanka Fernsia Purnama, student number 148, and I will explain about differential diagnosis of immune thrombocytopenic purpura. There are several differential diagnoses of immune thrombocytopenic purpura. The first one is drug-induced thrombocytopenia, which may be caused by some substance such as alcohol, heparin, and sulfonamides. The second one is thrombotic thrombocytopenic purpura, which is a microamniopathic hemolytic anemia caused by congenital disease or absence of ADAMTS13 enzyme. This disease will affect mostly in central nervous system and renal. The third disease is hemolytic uremic syndrome. Other differential diagnoses are myelodysplastic syndrome, lymphoproliferative disorders, paroxysmal nocturnal hemoglobinuria, DIC or disseminated intravascular coagulation, and infectious disease such as HIV and hepatitis C.
My name is Putri Emilia Dewi with 3 last digit of student number 028, and I will explain about the treatments for immune thrombocytopenia purpura. The treatments used in ITP consist of several lines, starting with the lesser toxicity drugs. Corticosteroids were the first-line treatments, considering that corticosteroids yield an immunosuppressant effect that can overcome the triggering factors of ITP. Treatment observation may be needed in outpatient with additional comorbidities. The physician must be aware of the corticosteroid side effects that may arise due to the duration or type of corticosteroid use. Also, intravenous immunoglobulin or IVIG and intravenous anti-IgE can be an option for first-line treatments. The summary of first-line treatments for ITP, including dose and expected time or rate of platelet response, can be seen on the slide. Well, Second-line treatments for ITP cases including splenectomy, rituximab, thrombopoietin receptor agonist or TPORA, romiplostim, eltrombopag, fostamatinib, and cytotoxic immunosuppressants. A summary of second-line treatments for ITP, including dose and expected time or rate of platelet response, can be seen on the slide. And the American Society of Hematology 2019 guidelines for immune thrombocytopenia recommends adult patient treatment referring to several conditions that can be seen on the slide.
My name is David, number 74. So I will tell about complications of ITP. So the complication of ITP is internal bleeding and external bleeding. Internal bleeding is bleeding inside the body, and external bleeding is bleeding uh, from the skin. Bleeding caused by vascular wall damage due to thrombocytopenia. ITP bleeding are bruising on the skin or mucous membrane such as mouth. Another complication is bleeding under the skin. ITP patient may also have a collection of clotted under the skin that's similar to a lump that is known as hematoma. ITP patients may get nosebleeds during dental work, and they may get blood uh, in the urine and the stool. Intracranial bleeding may also occur, but it's very rarely. But it can be very dangerous. Another complication that may occur is fatigue. Fatigue itself is caused by low level of thrombocyte bleeding and steroid therapy. ITP patient may also have a risk of thromboembolic caused by an increase of antiphospholipid antibodies.
My name is Marco with name 057. I'll present about the prevention of complication that could be caused by ITP. Currently, there's no prevention for ITP. How we can prevent the complication that can be caused by ITP? Some complications that can be caused by ITP are hematoma, intracranial bleeding, and thromboembolic. The complication of ITP can be prevented by first, consult with your doctor about which drugs are suitable to you, because some drugs should be avoided which could enhance the opportunity of bleeding. Second, prevent yourself from injuries that could lead to bruising or bleeding. Third, look for treatment if you get an infection. Inform any symptoms to infections to doctor. Okay, thank you.
My name is Komangjini Putri, number 031. The prognosis of ITP. ITP that occurs in children has a risk of severe bleeding by 0%, while in adults it can reach 0 till 7%. Only 5% of all chronic ITP patients will achieve remission. The prognosis for ITP has improved with reduced steroid use and the development of new thrombopoietin receptor agonist or TRA. Factor affecting prognosis is duration of previous bleeding and onset bleeding symptoms. Primary ITP in children is a non-life-threatening disease that can heal itself. This disease will generally last less than 1 year. Okay, that's all for prognosis of ITP. Thank you.
Hello, now we have come to our conclusion in this student project. Immune Thrombocytopenia Purpura is an autoimmune disorder that affecting the normal platelets. For the epidemiology, for the children is 1.2 until 5.8 per 100 individuals, while the adult is 1.6 until 3.9 per 100 individuals. The etiology and risk factors such as environmental and genetic factors. Well, from the pathogenesis, we can conclude that immunoglobulin G, autoantibodies bind to megakaryocytes and platelets. The diagnosis is made based on medical history, physical examination, and test results. For clinical manifestation, we can see there are some petechia, purpura, and ecchymosis. And the different diagnoses we can see such as drug-induced thrombocytopenia, TTP, HUS, etc. For the treatment, we can use first line and second line. The first line like corticosteroid, and second line are like splenectomy, rituximab, etc. The complication of ITP is such as internal and external bleeding, and it can be prevented. The prognosis of this disorder is depend on duration of previous bleeding and onset of bleeding symptoms. And so there is the conclusion. Thank you for listening to our student project.